This presentation is made to you by me, Pa, her, and my partner, Alyssa Bauman. Our topic is about the fall of independent pharmacies. Here is an overview of what we will be going through. I want to give you a little bit of background about community pharmacies and the two types of community pharmacies we have, independent and chain. And then talk about the financial, social, and economical impact of both pharmacies, such as services offered, customer satisfaction, political benefits, and numbers of pharmacies that have came about, and the technology. And then we will end it with recommendations and action steps, such as reimbursement period, radius between pharmacies, and State Board of Pharmacies overlooked on the job market. What is a community pharmacy? It is a healthcare facility that provides pharmacy services to a specific community. It is usually found in the center of neighborhoods and supermarkets. Community pharmacies are an efficient way for healthcare professionals to interact directly with patients. They are often the first place to conduct basic preliminary health assessment of patients. The roles of a community pharmacist consist of processing prescriptions, collect and integrate information on patient drug history, monitoring of drug utilizations, and responding to questions and concerns. They also provide quick evaluations of symptoms, laboratory values, and immunizations. There are two types of community pharmacies. One is chain and one is independent. Independent pharmacy is independently owned by an independent party, and it is not affiliated with any chains or clinic. As of today, there is a low volume of customers who uses independent pharmacies. This independent pharmacy offers a wide range of patient services along with specializing in certain areas such as nutrition, delivery, charge accounts, compounding, and hospice. A few examples of these pharmacies is Hyatt and Yield and Dan Fitzgerald pharmacies. As for the other type, it is the chain pharmacy. It is corporately owned, where each chain store must comply to corporate policies and procedures. They serve a significant number of customers, and the pharmacist there spends about 69% of the time dispensing prescriptions and counseling with patients. Chain pharmacies also offer a few patient services, such as patient counseling, compounding, and dispensing, along with business management. A few examples of these pharmacies are CVS, Walgreens, and Metro Market. Community pharmacies are a great way for patients and healthcare providers to interact outside of hospital or clinic. By working in a community pharmacy, pharmacists are able to discuss the drug information and address concerns if the patient has any questions. There is a vast distinction between the two types of pharmacies in regards to social and political and financial benefits. The first difference between these two types of pharmacies is customer satisfaction. Customer satisfaction is tied to the numbers of customers the pharmacies serve. There is a higher rate of customer satisfaction when there is a smaller volume of customers to serve. Since independent patients' volume is small, the pharmacists are able to spend more time with each of their patients, including being able to do a more thorough research on drug information, requests, and questions. According to a consumer report poll, patients reported a 94% satisfaction rate. This poll was conducted based on service pharmacist knowledge regarding drugs, accuracy, speed, and helpfulness. Unlike independent pharmacies, chain pharmacies have a high volume of customers to serve daily, and this makes it difficult for them to spend time with each patient for their individualized needs. Patients have complained that they have received the wrong medications and are many times left speaking with technicians rather than actual pharmacists. So the higher the volume, the lesser time the pharmacist can provide one-on-one time, which leads to a lower satisfaction rate from the public. And there are political benefits for both community pharmacies and their patients. One of the political benefits is the Affordable Care Act. As of January 1st, 2003, This act has brought in pharmacists to help patients by bringing providers of medication therapy monitoring to eligible Medicare Part D recipients. This gives rise to comprehensive medication reviews and management of patients' overall regimen. Because of the ACA, pharmacists are now more involved than before. They are able to share their knowledge, skills, and technological tools to educate patients and to discuss with doctors about potential drug interactions. Another benefit from this is that pharmacists are able to offer a few more services that can be paid for by Medicare. The American Medical Association provides 3 billing codes for pharmacists to get reimbursed. Under this act, the Medicare will pay for these services for eligible Medicare recipients, and both pharmacies can actually perform these 3 services to gain a little bit of profit while they give their clinical services to the patients. Not only are the pharmacies benefiting from this Affordable Care Act, Medicare Part D patients are also benefiting. They are now able to get a type of discount during their coverage gap. The pharmaceutical industry is a money-making business, and each year there are millions of dollars spent by patients to the prescription market. Independent and chain pharmacies consume a large portion of the overall patient spending on prescription. Independent pharmacy prescription sales are approximated to $75.3 billion in 2015. The ACA gives independent pharmacists the opportunity to provide additional care to their patients and increase their profit margins, as I've mentioned previously. And in 2014, Walgreens had approximately gained $49 billion in prescription sales, and CVS had about $45.6 billion. In 2014, the top 50 chain store prescription sales totaled about $222.149 billion. The pharmacy industry has been exponentially expanding over the past 20 years. This expansion has been greatly noticed within the community pharmacy numbers. There were an estimated 24,861 independent community pharmacies in year 2000. And according to the National Community Pharmacists Association, the United States had 22,814 independent pharmacies in year 2014 compared to 21,394 chain, 8,301 supermarket drugs, and 8,300 mass merchandisers. Since community pharmacy numbers have been increasing, the financial aspects of business has been reflecting the census. However, the financial increases have been experienced by chain pharmacies. An increase in chain pharmacy numbers means there will be an increase in their financial gain. When the chain pharmacies expand, it potentially takes away business from the independent pharmacies in the area. This decrease in business negatively impacts the finances of independent pharmacies, which makes it extremely difficult for pharmacies to stay in business. New chain pharmacy locations are popping up monthly, and they are also buying over independent pharmacies. And independent pharmacies may have been the only pharmacy in the vicinity for decades, but that is not the case anymore. Just to give you a visual, this is a picture that shows the number of different community pharmacies in each state from the NCPA in year 2009. And the bolded ones are for independent, and the first numbers in each state is actually for traditional chains. With these added pharmacies, patients have to decide where to get their prescriptions filled, and they commonly choose the more convenient one. Although chain pharmacies are open 24/7 and on weekends and holidays, they are not always cheaper, and the experience is not always better for patients. Chain pharmacies are larger than independent pharmacies. There are more chain pharmacies, and therefore they have a greater revenue than independent pharmacies. Since chain pharmacies are profiting more money, they have extra finances to upgrade their technology periodically. Independent pharmacies are sometimes just trying to stay afloat, and they do not have the extra money to spend on upgrading or expanding their technology. Although this doesn't directly affect patient care, if the pharmacy is unable to receive electronic prescription, the prescriber might decide to send the prescription to someone that can accept it. The chain pharmacies also actually have some apps or software for prescription programs or patient programs, such as the QS1 or Epic. Another software that chain pharmacies are able to do is the mobile apps. For example, Walgreens has a mobile app where patients can now use to refill and check on the status of their prescription. These types of apps and software requires a lot of money investment. Another disadvantage for independent pharmacies is the cost of advertisement. Advertisement, as we all know, plays an important factor. Without technology, the only way to promote and advertise their business is by the word of mouth and/or paper ads. Chain pharmacies are able to advertise their business in the radio, TV, billboard much easier since they have a higher revenue and can afford those services to promote. Very few independent pharmacies are able to do this, to use this type of service. This presentation provided you a brief overview of what community pharmacy is and the variety of changes such as decreased income of independent pharmacies, increase in chain pharmacies, and the high competition between independent and chain pharmacies. Chain pharmacies are expanding and becoming a major healthcare provider for patients, which poses problems for independent pharmacies. After our extensive research, chain pharmacies are ever imposing on independent pharmacies. There are more chain pharmacies in the United States compared to independent pharmacies, which decreases the number of patients getting their prescription filled at independent pharmacies. This decrease in patient decreases the income generated for the business and is negatively impacting the number of independent pharmacies' ability to stay in business. Also, government programs like Medicare extend the reimbursement period for prescription costs. This delay in getting reimbursed may not be a significant issue for chain pharmacies, but for independent pharmacies, they have to sit on thousands of dollars, which some companies cannot afford. Chain pharmacies are overtaking independent pharmacies, which can be detrimental to the economy and entire healthcare system. And the impact that the chain pharmacies have on independent pharmacies is immeasurable. A couple of recommendations and suggestions that we thought would help to keep the independent pharmacies would be, first, one of them is to shorten Medicare's reimbursement programs for pharmacies, to release the financial strain, and then the second is to exclude chain pharmacies within 10 miles radius of the independent pharmacies. This will allow the independent pharmacy to actually be able to still serve their customers and not have a competitor near them. And the third one is to have the State Board of Pharmacies conduct a research on current job markets to ensure enough jobs for graduates and to maintain the thresholds of pharmacies within that location.